Hello and welcome to Read Scholars Live. I'm your host, Dr. Mary Fleming, and current president of Read Scholars. Today, I'm super excited to have one of our current fellows on our podcast, Dr. Zerita Buchanan, who is our current Joseph L. Henry Oral Health Fellow in Minority Health Policy. Thank you so much for joining us. How are you today?
Thank you for having me. I'm doing well.
Very good. So, you know, I usually like to start with a question about your journey and how you got to dentistry. And your journey is a little different because you were kind of born into dentistry, right? Fourth generation? Is that
I
right?
but I fought it for a very long time.
Well,
I
tell us
tried,
about your family and, how y'all got there and then, what made you finally come over to the dentistry side.
yeah, I fought dentistry for a while. I thought I would go into medicine. I've always loved science. And because dentistry was around in my family, my dad, my grandfather, and my great grandfather are all dentists. But it's actually my mother's side that started it. So it's my mother's father and her grandfather who were dentists. I thought I would just blaze a new trail, do something differently. But it was maybe my like sophomore year of college, I really learned kind of what I liked as a person. I love going to bed early. I love making my own decisions. I like to like set my own schedule. So I learned more about the autonomy of dentistry. And I talked to some of my friends who were in medical school or in residency, and they were like, their hours were just unbearable. And so God kind of aligned it for everything to work out. And I ended up going to UNC Chapel Hill for dental school. And the day after graduation, I started working for my dad's practice.
Wow, that is absolutely amazing. Um, and now you're adding on health equity to your long list of accomplishments and interests in dentistry. So tell us a little bit about, give our listeners some context about one. Let's start with why dentistry and medicine are separate, right? Because you kind of talked about you one lane or the other, and they are often separate and have a slightly different path as far as career trajectory. But in all honesty, most of what we do is in a parallel track, but has always been parallel instead of overlapping. So give a little context on why that separation happened historically, and some of the challenges that keeps it apart.
Yeah, dentistry is considered like a luxury to a lot of people. It's not something that people do routinely, even though you should be going to the dentist every 6 months for routine cleanings and exams. But a lot of people separate dentistry and medicine. I think some of that has to do with the fact that dental insurance and medical insurance are separate. And so people can't comprehend that they have two different ways to afford treatment because it's not explained to them. It's like this insurance world is something that a lot of people don't understand. And sometimes a lot of companies or schools will not give you dental insurance.
Mhm.
They'll give you medical, but they won't give you dental. So if you don't have dental, you likely aren't going to the dentist. But what we find, we know, the mouth is the entry to the body, right? So a lot of diseases can manifest in the mouth. That's why it's important, people who smoke or people who have uncontrolled diabetes, they're going into their dentist to have the oral cavity examined. Usually people go to the dentist when they're in discomfort, and that's, probably too late at that point. Um, so my goal has really been to educate people about how medicine and dentistry are intertwined, and how if you protect your oral health, you can help to protect your overall health.
That is a great summary statement. I do like the other one, like the mouth is part of the body. Like, why did we decide to take it out? It is definitely the gateway to our body in multiple ways, right? So you talked about chronic disease like diabetes and how that can affect our mouth. You talked about smoking, so behavioral changes that can affect our mouth and teeth and cause other diseases, right? We can also talk about oral health and periodontal disease and nutrition, right? So if your mouth is hurting, you're probably not eating well. But also if you're not um, getting your proper nutrition, your teeth are also going to suffer from that.
Right.
And of course, near dear to my heart, we often talk about oral health as it relates to maternity care, right? So there are diseases during pregnancy that can affect the mouth, disease of the mouth that could affect the whole body when we talk about infection, but also long term, like talking about the patterns of long term care, right? So thinking about brushing teeth early and often, even in infancy, thinking about formula feeding, transitioning over to um, whole milk, or all the milk choices that we have today are overwhelming. Transitioning away from human milk, or away from formula. And when people start adding things like juice and
Yeah.
soft drinks, and how to choose those things, when, if ever, to add those things, and then how that affects our oral health as children and going on through um, adulthood. And then tackling on another thing, and when we talk about the grand scheme of health equity, because I think everything is
Yeah.
related to health equity and everything's intertwined, but thinking about our young kids, again, teeth pain,
Mhm.
nutritional deficiencies, you go to school, you don't learn well, right? And
Exactly.
so we have to think about these things all in tandem, because it's not just, oh my, I have a toothache, right? It can spill over to the rest of your life.
Yeah, it definitely can. And I mean, a lot of data shows that your quality of life decreases when you start losing teeth. So typically in minority communities, what's the first thing you'll do if you get a toothache and it's severe? You'll likely opt to extract the tooth, which isn't the best route, but it's most economical for people. And it's an immediate relief of discomfort. But if you don't replace that tooth, you're not going to be able to function and chew your food, right? And that also, when you start missing a lot of teeth, it can affect your self esteem, how you interact with people. Are you feeling confident going to job interviews in this day and age of Zoom when you have to take your mask off to speak? Are you feeling comfortable? So, what I try to do in my practice is really educate people on all of their options, but talking to them about taking care of their teeth from a young age, because as soon as you lose teeth, you start to lose bone. And that's what really gets people in situations where they're not good candidates for replacing missing teeth. Because if you lose that foundation, you're probably not a great candidate for something that's fixed into the mouth, meaning like an implant, right? That's why you see a lot of older Black people with removable teeth. They have removable partials or dentures because they just started extracting so early. We also see that in some of our like Caribbean cultures. A lot of times people just extract teeth left and right. And so we're trying to, you know, educate people, save them by all means. But you brought up the maternal oral health. That's something that I'm really interested in. Moms with cavities are twice as likely to have kids with cavities, right? And if we don't tackle that issue and take care of our health first, how are we going to take care of the health of our child, the oral health of our child? And you're absolutely spot on. The number one reason children miss school is not because they're sick at home. It's usually because they're going to the dentist. They have, a dental issue. It was a huge story. Diamante Driver was a young Black 12-year-old who had a dental abscess, likely started as a cavity. Mom couldn't afford treatment, or she couldn't find a dentist who took her insurance. So they had to delay treatment. Eventually, that abscess grew, traveled to his brain, and he died. So the issue of oral health affecting other areas of the body isn't talked about as commonly, but it can result in death, unfortunately. Um, but when we talk about health equity, there are a lot of things that go through my mind when it comes to dentistry. One is we know that data shows people prefer to go to providers they feel like they can trust and they may, resemble them. They feel like they can communicate with them in a different way. They won't be judged. So if we really want health equity, we have to produce more minority dentists. And that's challenging for a lot of reasons. A lot of our students, dentistry is like one of those fields, unless somebody really kind of talks to you about it, you probably aren't leaning into it because it's like, who wants to do this? Who wants to be in the mouth? But it's actually like, if you're artistic, there are a lot of opportunities to,
Creative,
display
yeah.
your artistic skills. Yeah, I find that I love dentistry too because I just love talking to people. Like I love building relationships with my patients. I'm a general dentist, so I see them every 6 months. It's not like they come to me, I take care of a tooth, never see them again. Like I build relationships with their whole family. My practice is family oriented. Like I want people to feel comfortable bringing their child to me and their grandmother, you know? But if we don't have providers, people likely will not be seeking care. So that is something that I'm interested in changing that dynamic. Like access to care is something that's very important to me, but also just talking to people about food choices, drink choices, choices you can make when you're pregnant, avoiding tetracycline antibiotics. This is something, I hope people are having conversations with their OBs and their pediatricians, because if you take tetracycline when you're pregnant, it can stain your baby's teeth in utero, and that's something that someone may not know unless they have a provider who feels like they, need that information. And a lot of times we find the number one way children get cavities is they fall asleep with a bottle in their mouth. Why is mom doing that? Mom's doing that because she needs the child to go to sleep, right? So there are
Do
layers.
all of these other things while you're trying.
Yeah, do all of the other things. Like there are layers to that. And what's important for me is for my patient to be able to receive that information and not feel judged for doing the behavior before. Like as long as we can explain how to change that behavior, you don't have to explain to me why it happened. I just want to help you out of it. Um, we find also when you look in certain communities, food deserts exist. So if your option for drinks, the most economical option is a soda
Yeah.
instead of bottled water, or the community you live in, maybe they don't have fluoride in your water, maybe you're drinking well water, you don't have the same access to quality care. So that's the whole health equity conversation. It's larger than just saying brush your teeth and floss. you
Exactly.
know it is a bigger problem that we have to tackle from a policy issue and from an educational issue to give people equal chances to be healthy.
So you just, gave us a whole word right there. You dropped a lot. Uh, but a couple of things I wanted to underscore that you talked about, kind of going back and talking about extractions and being economical. And we talked about older Black and brown people, like my grandmother who had all her teeth pulled as a young woman, right? And so the whole time I knew her, she always had removable teeth, as you said. And but that really changes, like you said, your how your face looks,
Yeah.
your confidence, how well you're eating,
Mhm.
what happens when you lose them, which she also
Mhm.
did. Um, and so it's not just as simple, but I think that also underscores who our providers are,
Mhm.
the options that we're given, and
Mhm.
how we trust those options that we're given. And so I think those things are overlapping, and having more proper informed consent
Mhm.
could change a lot of that.
Yeah.
And so I think that feeds into the pipeline that we talk about. I think the other thing, especially with the Demonte story, and you touched on this a little bit around coverage and reimbursement, and how we have these separate payment structures. But even with those payment structures that are entwined, if you have dental coverage, not everybody may take Medicaid coverage, right? And so even, and we talk about access doesn't often equal improved outcomes. Because just because you have insurance, if nobody takes your insurance, that's
Mhm.
not improving
Mhm.
your actual outcome and improving your access and your outcome. So I think that was another important thing to raise. And kind of then going back to mentoring. So you started talking about that conversation, why it's important to get more people into the pipeline. Talk a little bit more about the ways in which you're doing that, because like you said, it's
Mhm.
not always the shiny thing to do. And a lot of people end up, going, oh, I was going to do medicine, but decided to do dentistry once. Because for some of our training, right, we're together. Like I went to Xavier,
Mhm.
we were all together in undergrad, and then people divvied out. But for people who don't have that experience or didn't, I grew up going to the dental clinic with my grandfather. He was very very adamant about supporting the kids because they needed to learn. And he was like, he was going to do his part. So we went to the University of Louisville Dental School clinic, for his 6 month checkups, and so I was that was part of my world. But not everybody has that type of exposure. So talk to us a little bit about how you're, trying to get more people exposed and keep them engaged, right? So it's exposure, but also retention.
Yeah, so I am a proud Spelman College alumna. I'm an HBCU
HBCUs.
enthusiast, yes. And my mentor actually is also a Spelman alumna, and she is a dentist. And she founded a program called Increasing Diversity in Dentistry, where she basically helped to mentor and cultivate young students who are interested in dentistry, starting in the AUC, so starting at Spelman, Morehouse, and Clark. And then the organization grew. She had students coming from all over the country, primarily historically Black colleges and universities, but our membership has grown to over about 600 students. And so I joined on with her when I graduated dental school as assistant director. And we host different events to help students become competitive applicants for dental school. But what I love about IDID and what I love about what Dr. Holloway has founded is once we get you into dental school, we don't forget about you. It's important if we lead people into the health sciences and healthcare that we remember the journey is long and it can be hard. And she has formed a family, a network of students who kind of encourage each other along the way because there's different hurdles that our HBCU students have, right? We've noticed some trends of a lot of students having to work while they're in undergrad.
Mhm.
We've noticed trends of students getting to dental school and still having to support financially, maybe family members. These are stressors that other groups don't necessarily have, and it can take away sometimes your ability to focus, right? Um, that doesn't make you a bad student. It just means your road had a few more obstacles in them. So when I think about health equity, not only should we think about it from the patient perspective, but also the student perspective. There are certain things that institutions can do to create a culture that really supports students. There's financial things that institutions can do to help students. So IDID has served as this foundation to expose undergraduate students to dentistry, but also to carry them through the journey. And we know, minority providers usually go back to minority communities. So it's my reasoning behind coming to the fellowship and coming to Boston is to make sure that there are equitable opportunities for us to become healthcare professionals, specifically in dentistry. But I love working with the students. It's so crazy to see them take their DAT, get into school, graduate, go work. Like some of them have become specialists. It's like a beautiful circle. It's a beautiful family. My immediate family is really big on the saying, if a door has been open for you, do everything in your power to keep it open for those who come after you. That has just been something that my parents have drilled into me from the very beginning. So I enjoy, the opportunity that I have now to be able to open up my office for people to come and shadow. And it's hard, I know a lot of my colleagues, they want to do things too to give back to students. And I tell them, if you want to give back with your time, or if you decide you want to give back with your money, if it's a letter of recommendation, there are multiple ways to give back because people are busy, right? We have kids, families, like people have things to do. But I've been able, I've been blessed to have my own private practice. So I allow students to come in, and I am of the generation that free externships are a thing of the past. Like I pay the students to come because it costs money to apply, so they're trying to get this exposure. They want shadowing hours. They want to learn about dentistry, but they also need to make some money. So I was able to launch a dental assisting school for students during the pandemic for them to come in, learn how to be dental assistants. And then that's a skill that they can transfer with them along the way. Because the economic battle is hard, applying to dental school can cost upwards of $2,500. And if you don't have a job, how are you doing that? How
Yeah.
are you doing it? So,
Yeah, I definitely remember those days.
yeah, it's hard. And I tell students, a lot of students that I mentor, I'm like, if you're going to do a summer research program or something, find the ones that do have stipends. You know, pick the ones that are at schools you want to go to so you can ask your PI or your program director for a letter of recommendation. Like you have to be strategic in this game. But if you get to senior year and you haven't heard these tips, you're going to be behind the curve.
Exactly. And I think that was one of the things that I'm very grateful um, for Xavier for was preparing us for. I mean,
Oh,
they,
yeah.
the process was very well prepared. But I think what also I felt the most when I got to Vanderbilt is that support was no longer there. Those tips were no longer readily
Mhm.
available. And, entering into an environment where there were more people who had come from families that had been in medicine or or
Mhm.
at least had brothers or sisters or somebody else, some type of mentorship in medicine. And I came in without anything. You definitely feel behind the eight ball, and right, you're
Yeah.
at the end and you're like, well, if I had somebody had just told me, like, this is not new information. It
Right, right.
just, no one shared. And so I think I commend you for all the work that you're doing to try to give people those stairs to step on and shoulders to climb on, so we don't have to keep reinventing the wheel and start off behind. And we could talk about that all day.
Yeah.
But the other thing I wanted to highlight that you just mentioned, so in the for our listeners, we talk about DEI, DEI all the time, but we're now talking about diversity, equity, inclusion, and belonging. And
Mhm.
so a lot of times when we get to organizations, we don't have that sense of belonging because of our background, our competing priorities, whatever. It could be a lot of
Mhm.
things. So I like the idea, and that's one of the things Dr. Reed tries to create in our fellowship program. It sounds like that's one of the things you try to create as a group, and I did, is to say, well, even if you don't have that sense of belonging in your institution where you're at, you can have it with us, and you can take your fellowship, you can take your cohort with you wherever you go. And I think that's really important, and I don't think it's appreciated across industries on how that makes the individual's experience better, but it makes the whole company's experience
It
better.
does. It does. It's important, especially in healthcare, because being a physician and especially a dentist can be isolating. Because a lot of times dentists aren't working in large hospitals, right? They're working in like a smaller private practice, maybe one or two doctors. But the idea of having someone to bounce a concept off of or talk to about case, treatment plans and things like that, it's important, right? If you're too isolated, your job can become your life. It can become consuming. And that's where we find a lot of people start dealing with depression, and who heals the healer? Like, who is there to talk to someone when they're going through these professional trials? Because it's hard. It's really hard. And what I like about the fellowship is all the people in my year this year, we've had very similar experiences because we were practicing during the pandemic. And it's like, you can't really explain to someone who's not in your field what that feels like, right? So just having support either while you're a student or while you're out in the field, it makes a world of difference. It sustains you, it keeps you going. One of the things, I'll do a small plug for my dental school because I love the University of North Carolina Chapel Hill. We were a class, I want to say maybe like 80 students, right? 80, I think it's gotten bigger over the years, but there were like 8 to 10 Black kids in my class. So, not super diverse, but also not one of the schools where you were the only person.
Yeah.
But what made UNC stand out for me was the fact that we had the support of Old North State, which was the local chapter of the National Dental Association. And there were also Black faculty at the time at the school. So when I walked into Chapel Hill, I'm from Georgia. All I knew was Michael Jordan. Like, I didn't know like Chapel Hill. I didn't know anything about the school. But when I went there, I saw people who looked like me. And after I interviewed, they took me out to lunch, the SNDA chapter. And I was like, I could see myself here.
Mm,
I remember the recruiter for the summer program there, Mr. Claudius Polk, he came to Spelman to talk about UNC. So it's institutions taking that extra step to come to the student, show the student that they will be supported. You know, it's the responsibility of the institution to provide funding to SNDA, to make sure alums come back. Um, if you want to decrease this access to care issue, if you want to eliminate that disparity, institutions who want to promote diversity in their schools have to produce a culture that allows for belonging, because it's hard. I feel like I had the best of both worlds. I got 4 years at Spelman, which like was the best decision of my life because I'm there. I do not have to speak on behalf of the entire Black race every single day. I'm there around women who are doing awesome things, pushing me to another level. Like Spelman nurtured my soul, my mind, my spirit, everything. And it prepared me to go out into a world where I may be, one of 10, like it gave me that time to really build up my resilience to go into 4 years of academic like struggle, because it's hard in grad school, right? When you go to those schools, though, you still need that support you had in undergrad to get to the finish line. So it's great when we see, the taglines, DEI, all those things, but is the culture there? Are the students feeling it? And that's where I feel like my journey and my work is now. It's expanding here in the fellowship. I'm learning how I can be involved on the other end. I work with the students, but now I'm learning how I can work with institutions as well.
I love it. I similarly, I tell people all the time. So SNMA, right, the Student National Medical Association, got me through medical school, right? And there were some other very instrumental people like Dr. George Hill, who was our dean for diversity at the time, and so there were definitely influential people. But the student groups are just phenomenal. Having that support, having like-minded peers that you can lean on, the resources and the networking that you have access. So if there's students listening, definitely find your tribe wherever that might be. Lean on those people. Build a community, even if you're one of a few where you are. And I think the other thing that you said is they have to have the effort and do the work to change the culture. So it
Mhm.
can't just be in name.
Mhm.
There has to be the resources and the support around changing the culture
Mhm.
promote health equity, or which, depending on what space you are, or diversity, equity, inclusion, and
Yeah.
belonging.
And the cultural competency, those courses need to be taught. Like this doesn't need to be a discussion amongst Black providers only.
Right.
This needs
It's
to be a discussion
across the
everywhere.
board.
Yeah, across the board.
Well, I have kept you too long because our conversation was so great. I really appreciate it. But as we close, what I would like to ask is, what, because we touched on self-care a little bit, and we could go on down the road about thinking about medicine and dentistry and that career, and how we don't take care of ourselves, and the rising rates of depression and mental illness, and even suicide is just, especially after COVID. I mean, it's just
Yeah.
horrendous, right? But since we don't have time to delve into that today, but as we talk about aspiring students coming behind us, what advice would you give them, as far as either pearls of wisdom, something you wish you knew, or even what do you tell yourself on those really hard days when you don't know if you can put one foot in front of the other? What would you tell them?
Um, I tell a lot of students that if we can reflect on where we've come as a people, it will help to inspire and motivate us to keep going. There were Black dental and medical students going to these institutions knowing that their lives may be in jeopardy. There were Black business owners having their buildings burned down, and they regrouped, kept going, persevered. nothing is impossible. If they can do it, we can do it. So I tell a lot of people, know where you came from, to know where you're going, but it's also important to accept help when it is presented. I never really identified when I was in undergrad that I had like issues with anxiety. Undergrad was great, right? But when I got to dental school, I noticed like my sleeping patterns were a little off. And I remember specifically sitting in church and like not being able to focus on the sermon because I was thinking about all the exams I had.
Mm.
And when you start to have those feelings or you notice that something is off, it is okay to seek help, right? A lot of times I hear people say, well, I can't get help because then they may not think I'm qualified to take care of the next person. You absolutely can get help. It's fine to ask for help. When I was at Chapel Hill, I used student health services to find a therapist. When I got out of dental school, I found a therapist. It's important to take care of yourself and rejuvenate because you'll be a better provider when you're feeling good. I think the best thing that anyone ever told me too when I went into private practice is you cannot work Monday through Friday. You just cannot do it. If you have the opportunity to structure your life so economically you can survive working maybe Tuesday through Friday, do that, because that one day a week for you to have time to rest and rejuvenate, it's like the weekends just fly by, right? But I don't work on Mondays, and those are my days to make sure I go grocery shopping, or I, extend my weekend vacation one more day, or I meet, with the chiropractor or go to my primary care. Like, you have to structure your life in a way where you prioritize self-help. I've been like on this whole soft life phase, which is like a theme on social media about embracing the soft life. A lot of times we as Black and brown people have this, I've got to endure, I got to keep going, I got to never stop, never rest. And we're almost taught that we're strong enough for anything, but really your life, abundance is your birthright. You are not meant to struggle all these days. You should be experiencing soft love, soft joy, happiness, So I've been trying to tell students, when you see those signs, restructure something, reroute something, because if you burn yourself out, you're not going to be of any use to your community.
It is absolutely true. I always say you can't pour from an empty cup, right? You have to refill and replenish. Um, and a lot of us aren't taught that we're supposed to be or allowed to be happy, right?
Mhm.
Life is rough, and that's the pep talk. Life is rough. Get over it.
Get
Buck up,
over it.
buttercup. And it doesn't have to be that way. And I try to tell people the same thing. I prioritize myself first, and everything else afterwards, because if not, we won't have anything left to give. And that's not
Right.
what we're here for. We are trying to build a life that we have an abundance to give back so that as many
Exactly.
people can live their best lives as possible. And I think you are absolutely doing that. And so I am so proud of you, so happy that you've become part of our fellowship family. And I'm looking forward to all the wonderful things that you're going to do going forward.
Thank
Um,
you.
you're welcome. But with that, I will close. Thank you again for coming on. And maybe you'll even come back on again and we can talk
Yeah,
about some of the things we didn't get to dive in deeply on today.
for sure. Thank you so much for having me.
See you soon. Thank you for listening to Read Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube